I would like to ask your permission, both of you, to use this video for educational purpose and on the internet.
Sure.
Okay, now tell me about your symptoms before the surgery. What was bothering you?
Before the surgery, I had back pain and pain that was emanating from my back down into my thighs.
Okay.
Shooting pain.
Both sides?
Both sides, both legs.
How long did you have it?
I had it increasing in pain for over 2 years.
2 years. 1 to 10, how bad was the pain, the intensity?
At its worst, it was in the 8 to 9 range, yeah.
How far could you walk?
I couldn't walk much at all. Even with assistance of poles, I couldn't walk. I couldn't stand I couldn't stand for a minute.
Oh, wow. Now, you made a huge trip to Crookston to do the surgery, right?
I did that.
Yeah.
That's how desperate I was, given the COVID environment.
Yes. We couldn't do that because of the COVID. We couldn't do the surgery in town.
Right.
So we took you to Crookston. How long did you stay in the hospital?
2 nights.
Do you remember the surgery?
Do I remember the surgery? No.
Maybe sometimes that's a good thing. You don't remember it.
I remember before the surgery. I remember afterwards the recovery. I don't remember the surgery itself.
So I have the report of the surgery. Our surgery was about 2 hours, and we lost half a cup of coffee blood. That's all we lost. Actually, a little less. We lost less blood than half a cup of coffee. For a 4-level scoliosis surgery, here it is. You got a 4-level fusion. That by any means is a big surgery. And that is one more, and that's the maximum surgery you can get in your lumbar spine. The bone is growing, your scoliosis is corrected. But how is the leg pain? How is the back pain?
The back pain's gone. The pain in my legs is gone.
When did the leg pain go away? When did you notice the leg pain is not there anymore?
Oh, soon after the surgery, I noticed.
You woke up and the leg pain was gone?
Yeah.
Okay. And the back pain? How long did that take to go away?
Probably a month.
A month.
Yeah.
Now, they are telling me the pain at this point is zero.
No pain.
No pain.
No pain, no shooting pain in my legs, no pain in my back.
But we are not perfect. You still need this walker.
We're not perfect.
Yeah.
My left leg is a little bit weaker than before the surgery.
Yeah. And I checked that it's mostly your tibialis anterior, the muscle that bring the foot back up. Yes, it is weak.
Right.
It's what we call 4 or 5, meaning you still have some function. You still have some good function there, but it is definitely weaker.
Right. And so I need to use the walker to walk around now. And we're working PT and trying to get that better. And small incremental improvement.
Yeah, we are about a year out, correct?
Correct.
Actually, a little more than a year.
Mm-hmm.
How far can you walk without the walker? How far can you walk with the walker?
Without the walker, I can't take 2 steps.
So it's still very dependent on the walker.
But with the walker, I can pretty much walk wherever I want to.
So practically no significant limit with the walker.
Right.
Now we have some additional factors that complicated our surgery and recovery. One of them is always the diabetes. Diabetes is always a factor. You don't smoke, so that's not a factor for you, but your BMI is 42. And that as well is a mechanical stress. These are the factors. As a matter of fact, some of our societies tell us, don't do this surgery for somebody BMI of about 40.
Mayo Clinic wouldn't.
Yeah. What did they tell you?
They told me to come back if you start having incontinence problems.
So they mean that, literally you have to wait until the situation may become irreversible.
Right.
Live with it. More or less they told you live with it.
Right.
Was it livable?
No.
So
I had no quality of life.
Yeah, you had no quality of life. Why do you think Mayo told you that they cannot do the surgery until the situation is really that grave? How did they explain that to you?
They didn't give me a good explanation. I think it had to do with perhaps the length of the surgery required. I don't know. With a BMI like that, I don't know.
Well, I think actually they did the right thing for you, because the way this surgery is done in a traditional way, in Mayo Clinic or anywhere else, is about, for a 1-level fusion, is about somewhere between 3 and 4 hours, and that is their average. Now, doing it for 4-level, that would be a 12-hour surgery or 8-10 hour surgery in your BMI, even maybe higher, and that the amount of the damage we do in open surgery to fix the problem, it's sort of the surgery causes more damage than good.
Okay.
So in a way, they weighed risk and versus benefit. They were a good surgeon, and they just measured that risk versus benefit, and they told you in their hand the surgery is more dangerous than your disease, even though unfortunately your situation wasn't livable. So in a way, they did you a favor.
So we found you, and the rest is history.
What do you understand why I could do the surgery that Mayo couldn't? What do you remember we talked about?
Oh, clearly you don't rip through the muscles in the back as Mayo would have, and you go in and target it, and I think there were eight or 10 holes in my.
There are lots of small holes.
Of little holes, but little holes, no major cutting through the muscles, and so I think it did help with the recovery time.
And as well that you lost only half a cup of coffee, because if you show that in this kind of instrumentation inside, and you tell any surgeon the surgery was 2 hours and we lost half a cup of coffee, even spine surgeons have difficulty to wrap their head around it. Except those who come and get trained here. Now, overall, so far, again, this is about that. This is not perfect because you still need the walker to walk.
And I'd like people to get beyond that, but
and
we'll see.
we still move this. We are a little more than a year. This is not the end of story, okay? But overall, happy so far.
I'm very happy that I can get around, that I can do some things that I want to do, and not feel like I can't take 2 steps without pain.
Yeah, and that is, I think, the idea is to making you as independent as we can. Well, thank you so much for the interview. I really appreciate that.
Thank you,
okay?
Doctor.
Thank you.